Shawn and Sue with you on a Friday. It's our final Friday on the Pacifico patio, powered by our friends at RWJBarnabas
I'm
Health.
so not ready for it to be over.
We're packing up. We're putting the umbrella and the chairs in the car and everything. Right now, we are joined by our friend, the Chief Executive Officer of Community Medical Center. Patrick Ahearn joins us to sort of put a finale on this summer of 2024. Pat, welcome and good morning.
Good morning, Shawn. Good morning, Sue. Always a pleasure to be with you guys. I miss you. I miss being there in person with you.
I know. We have so much fun. But you know what, Patrick, what they say? New Jerseyans, this is our time for the beach, right? It's
Absolutely.
our time to get to the beach right now.
So, Pat, we've heard that you've had a very busy summer at Community Medical Center.
Yeah.
What have you been up to? What's been going on? Tell us a bit.
There's a lot of stuff that's happening here at the hospital, which we're really happy about. But before I even get into that, I just want to thank you guys, both of you, for all of the people that you've had on during the summer from Community. You've heard from really good people that have told great stories and given some information, feedback, and knowledge to the people in our community. So I'm really grateful. So thank you guys for doing that.
Yeah, you gave us a great lineup
yeah.
of health professionals, so it's been really good.
Great this year.
Yeah. Well, and so what's going on here is we continue to provide great quality to our patients. We get a lot of commendations and things from outside agencies. Leapfrog is one of those that rates hospitals, all the hospitals in the country, and we keep getting A's from Leapfrog, which really talks about the quality that we're delivering here. We also have gotten accreditations for bariatric surgery and robotic surgery, and so we're really proud of that. We also, there's another agency, Health Grades, that rates hospitals, and we continue to get 5-star ratings from them, and especially for our surgical care, 3 years in a row, which means we're in the top 5% of the country in the care that we deliver for surgery. So, these awards are determined by hospital data, which is great. So it's basically not me just saying something to them. It's about them looking at the data that we have and what we're doing here. And so I'm really proud of the things that we're doing and the accolades that we're getting from outsiders.
Any news from your residents, Pat?
That was a big deal. Shawn, we've been working on that for a few years. About 3 years ago, we started a residency program, and we had our first graduating class in June. I couldn't be more proud. It was exciting, and it's made a huge difference in the institution. Just the way we're delivering care and the way people feel, and having residents here has really been spectacular. This year, we're going to have over 100 residents.
Wow, that's amazing.
Yeah, it is. It's really great because it really pushes the clinicians to be at the top of their game as they're asking a million questions, which is really great, and it makes a difference in the institution. We've also expanded, from when we started. We started with internal medicine and emergency room and podiatry, and now we added surgery and a thing called transitional residents, and we've got fellowships in ICU and pulmonary critical care. So it's exciting. It really is.
So driving by recently, I can't help but notice a lot of construction going on at Community.
A little bit, huh? We've had the big crane there, and it is. It's fabulous. This is about the master facility plan that I talked to you guys about a year or two ago.
Yes.
Saying we're going to transform this hospital. We're going to give the people the setting and the employees the setting that they deserve to do their job. I mean, the hospital is 60 years old, and so first phase of that, you see, was the parking garage. So we're just about finished. There were 800 pieces that were put together to make up this parking garage. It'll be twice the size of the original one, and we're excited about that. It'll be open in January, and that's the first phase. Once the garage opens, right now we're using some of our land to park the cars that obviously, that will go in the garage, and then we'll start the next phase, which will be a central utility plant, and then we'll put up a big addition after that. So we're thrilled and excited. It's changing the landscape of what we're doing here.
We're talking with Patrick Ahearn, the Chief Executive Officer at Community Medical Center. Pat, is there anything, as we wrap up here, is there anything else that you'd like to talk about as we celebrate the end of another great summer?
Well, one of the things that, again, part of our commitment is to change what we do here and to really give the people of the community what they needs. So one of the things was, as you guys know, we finished our emergency room renovation, which we were thrilled about, and actually we're getting fabulous comments from the public and employees. So that's been a huge success. But it's always about the people. It's about the people and how we take care of our patients. When our community comes to us, they're sick, they're hurt, they're scared. What we need to do besides providing great care is deliver that care with compassion, kindness. We've been focusing a great deal of effort over the past year on building our culture of kindness, and it's certainly paying off. The anxiety of our patients and family is reduced when we do that, and our staff feels better. This is showing, that that we care about our patients, and it's certainly showing up in the comments that we're getting from both staff and our patients and their families. And despite all the fancy equipment and all the buildings and everything else, we're in the people business, and we're here to take care of people, and that's really the heart and soul of what we do. And my last comment about that is, I've told you guys in the past, we're responsible, at least I feel, we're responsible for the health of our community, the 600,000 people around this institution, not just in the hospital, but outside the hospital, the health of our community. And so one of the things that we've done recently is food insecurity is a big deal, and not just here, but everywhere. And so we've partnered with Sadie Vickers, and we have a garden that all of our employees are volunteering and putting up, and you're going to hear more about that. But we're bringing fresh produce and nutrition to our community in South Toms River, and that's one of the first steps in us getting out and not just helping people when they're sick in the hospital, but how do we impact the health of our community going forward. So a lot of crazy, exciting, wonderful things going on here, all for the better for our community and the people we serve.
Oh, it's wonderful.
We want to thank you once again
Love
for giving
having
us
you
the
on, Pat.
power to be on the boardwalk all summer, and as you said, to be able to talk with your fine medical professionals as well. So it's a great partnership. We look forward to it every year. And thank you, Pat, and everything you guys do at Community Medical Center.
Well, thank you guys for always supporting us and being a part of what we do, and I appreciate spending a few minutes, so thank you. Nice to talk to you.
All right, Patrick Ahearn there. Thank you.
And if you want to get more information, go to rwjbh.org/community.